Today we will talk about no mesh repair for inguinal hernias, and I will spend a little bit of time explaining the Shouldice technique. A lot of patients come to the office and ask for tissue repairs for their inguinal hernias, and while tissue repairs have been existent for many years, they have their own limitations. I started my surgical training in Romania at a time when mesh was considered a luxury. At that time we only did tissue repair, very rarely had meshes available. Most patients did well, but also some of them recurred. So what should be our goal as hernia surgeons? As one of my colleagues and former president of the American Hernia Society, Dr. David Chen, says, our goal should be to have an incidence of chronic groin pain and hernia recurrence below 0.5%. And this is where the mesh comes into play, and mesh repairs have been able to decrease significantly the rate of recurrence, which were seen with open tissue repairs or repairs without mesh, to such low numbers. There have been many different tissue repairs described over the ages, but very few stood the test of time. And the Shouldice technique is one of them, and it's still considered the standard of care for open inguinal hernia when no mesh is used. It was described by Dr. Shouldice in Canada, and the Shouldice clinic is still in operation today outside of Toronto. The technique has been popularized in the rest of the world, and we employ it in our practice as well. What is it? Shouldice technique is an open inguinal hernia repair which involves reconstruction of the layers of the abdominal wall in the groin region using sutures. There are 4 rows of sutures that are used. The first 2 rows use permanent sutures, while the second 2 rows, the ones closer to the surface, use resorbable sutures. So basically, after opening the skin and the inguinal canal and visualizing the hernia, reducing the hernia contents back into the abdominal cavity, the surgeon actually cuts the innermost layer of the inguinal canal called the fascia transversalis. So that is cut purposefully with the scissors, and afterwards we start the reconstruction of the inguinal canal. And the reconstruction imbricates the layers of the abdominal wall so that the rows of sutures overlap. The Shouldice operation is overall a great tissue repair technique when used selectively in the right category of patients.